Hi everybody, my name is Dr.Johanis. I'm actually a cosmetic surgeon in the United Arab Emirates, or Dubai, as most people would know that area as. And I have come to try and improve on my previous plastic surgery, to be quite honest. I've had several procedures done in the past: eyes, face, nose, and even a hair transplant, believe it or not. And before you think I look like a plastic surgery junkie, the main thing is that the things that I wanted to address, for example, the nasolabial folds, and they just were never addressed properly. And for a while now, I've been trying to find a plastic surgeon that would understand. I mean, I think anybody can do a facelift. All of us, all plastic surgeons can do a facelift. But there is a certain artistic interpretation of basic skills that are very important in terms of trying to decide what to do. And hopefully the results will show that, you know, this is going to be what I want, and we will see how it works out. Well, I mean, we met at a meeting in Las Vegas, and you know, when we got talking, I figured, you know, this is the person, because, you know, as I said, I've been speaking to lots of colleagues over the years at different meetings, and just to find somebody that, you know, I had a gut feeling was going to be all right. You know, you look at internet ads and things, and there's all this razzmatazz, you know, come to me, I'll sort the world. I mean, it's you know, you get so sucked in by all of these things. So, you know, to try and find that is very difficult. Is something that's a two-way traffic, by the way. I mean, I think patients select their surgeons as much as the surgeons select their patients. And there's a subtle, discussion that will go on where you'll know this patient has now decided that they like me, or I've decided that I like them, you know. And I think everybody has a gut feeling about things, and that's all you can go on. When a person or a surgeon performs the procedure, they have to rely on all their skills to interpret that situation when they're doing it. So if you're combining different procedures like fat transfer, or, you know, facelifting, neck lifting, and they all consist of subdivisions. I mean, a neck lift is not just the skin, there's the muscle, there's the salivary glands that need to be shaved, for example. There's muscles that may need to be removed if you've got these muscles here at the bottom. So there's all composite things that you need to do in terms of what, and, you know, if we call this the Dubai lift, it would be the interpretation of using fat to refill a facelift, basically. Thin people age badly, no matter which way you look at it.
Yes.
The skin doesn't have any support, as you can see. I mean, I've even had cheek implants put in, and, you know, you don't see any evidence of them here at all. So just doing this is not good enough. You need to fill that part as well. And the same goes for temples, for example, or, you know, there are all sorts of things where you will need to add volume. Mm-hmm. And even eyes, sometimes if you take the skin away, you need to add volume. But anyway, so this is the Dubai lift, which will be the combination of all different kinds of procedures, which are face procedures, specifically for, I suppose, a guy in their mid-50s, which I am, and, you know, to set the clock back a few years.